interactive learning. And these live classes are also taken up by the expert educators. We also have express exam modules. This is specifically designed to cover your entire syllabus in under 20 hours, especially when you need to cover your entire syllabus in such a short duration of time just before your exams, so that you cover your entire syllabus and not miss out any important concepts and important topics that is very important for your exams. Okay. These express exam modules provides strong emphasis on answer writing skills to give you high scoring responses. And these exam modules also these are also taken up by the expert educators. Okay, we also have one-to-one doubt clearing session, which provides us to create a very safe learning environment, and it is a very student-centric approach. Every question, no matter how small, is valued, and you can ask your respective tutors or any tutor regarding any doubt. Okay, and you can get your queries resolved as soon as possible. We also have hard copy note set. These notes are made in a very crisp and concise manner, so that you don't need to read every line of your textbooks, which is very difficult, okay, just before your exams and also while reading anything. These notes are made keeping in mind your past 10 years previous year question and the most anticipated questions that could come in your exams this year. And also these notes also has beautiful diagrams that you can draw in your exams, and written in a point-wise. All the notes are written in a point-wise manner, so that it becomes easier for you to retain those things and not just paragraph reading. Okay, so these notes are very useful for you if you read it from here. Okay. Coming next, we also have question bank. Question banks or practice session is very important for you to practice before appearing for any exams. And these question banks provide you a sense of confidence. Okay, it gives you a sense of confidence before appearing for any exams. It covers MCQs for your prof exams, for your NEET exams, FMG exams. It covers MCQs of all level from beginner to expert level. Okay. Practical sessions are also very important, right? Because practicals carry equal weightage as that of your theory sessions. These practical sessions at Auricle provides you hands-on experience for understanding of MBBS practicals, and it also teaches you the technique, how to give your answers in your Viva questions, and all the skills that are required in your practical exams, right? And these practical sessions should not be missed because it is very important, and people often tends to give less importance to practicals, but it should not be like that. Okay, so we have 4 kinds of subscription plans: foundation plan, advanced learning plan, complete learning plan, and ultimate MBBS plan. These 4 plans vary according to their duration of their validity. Okay, so we have 3 months, 6 months, 12 months, and the complete 4 years. That is your whole MBBS journey. Okay, so you can opt for any plan according to your needs. Okay, and if you opt for this 4-year ultimate MBBS plan, you will have access to everything right from the starting first year till your last, that is final year. Okay. So today we'll be discussing the topic disease of vitreous, or the vitreous humor, about vitreous humor. Okay, so we'll be discussing about the vitreous humor. Okay, first of all, we'll be discussing vitreous hemorrhage. Now, this is one and the most important topic. Okay, so if you get any question from vitreous, 95% chances are there that the question could be from the vitreous hemorrhage. Okay, so because this is a very, very important topic in the vitreous part. Okay, now the vitreous hemorrhage. Okay, now you know the meaning of the term hemorrhage. Hemorrhage means the flow of the blood. Sorry, leaking of the blood. Leaking of the blood into the internal organs. Leaking of the blood from the blood vessels into the internal organs. Okay, so definition is the leakage of the blood into the vitreous cavity. Now, where is the blood leaking? It is leaking in the vitreous cavity due to the disruption of retinal or the choroidal blood vessels. Okay, so there are blood vessels in the retinal layer and the choroidal layer, but more blood vessels are present in the choroidal layer since it is made up of pure blood vessels. Okay, retina also has some blood supply from the retinal vessels, but choroid is mainly the source of many blood vessels. Okay, so if there is a leakage of blood into the vitreous cavity, now where is the vitreous cavity? I'll tell you. So this is our cornea. Okay, this is a cornea. This is a complete eyeball, right? And this is the lens. So this complete part which I'm drawing with blue, this is the vitreous humor. Okay. Now, if there is a vessel, this is the retina, right? And just behind the retina is the choroidal layer, and behind that is the scleral layer. So you can get a bleeding from this retinal vessels and from this choroidal vessels. Okay, so in these two layers, blood vessels are present, and due to the disruption of these blood vessels, there can be leakage of blood from the retinal blood vessels, and from the retinal blood vessels, and from the choroidal blood vessels, and these blood will leak into this vitreous humor, and collection of the blood in this vitreous humor is known as vitreous hemorrhage. Okay, you can see this vitreous hemorrhage with the help of the fundus examination or fundoscopy. We'll discuss later how to identify the vitreous hemorrhage. Okay. Now, what are the components of hemorrhage? Okay, hemorrhage means blood. So whatever whatever things are present in the blood, that will come in the vitreous humor. So what are the components of the hemorrhage? So there will be red blood cells. Okay, there will be red blood cells, RBCs. There will be inflammatory cells, including WBCs, right? Macrophages, WBCs, macrophages, and breakdown products of the hemoglobin. Okay, so if the hemoglobin is broken down, so the breakdown products of hemoglobin. Now, if I were to ask you what are the breakdown products of hemoglobin, only one most important thing that should come in your mind is bilirubin, right? Bilirubin should come into your mind. So bilirubin-like products will come into the vitreous humor. So you will have RBCs, WBCs, bilirubin, iron. So products like this will come into the vitreous humor as a result of the vitreous hemorrhage. Okay, so these are the components of the hemorrhage, of the vitreous hemorrhage, you can say, from the disruption of the blood vessels present in the retinal and the choroidal blood vessels. So this was about the definition components part. You can easily fetch 2 to 3 marks by just writing the components of the hemorrhage and the definition of the vitreous hemorrhage. Okay. Now, what are the causes? Okay, you can see on the right-hand side on the diagram over here. See, this is the complete blood accumulated in the vitreous humor, and this is the fundus picture. Okay, this is the fundus picture. This is the optic disc. These are the vessels, retinal or choroidal blood vessels. Okay, these are the retinal vessels, right? And this is the optic disc. Okay, we have studied about this. Okay, this is the optic disc, and this is the collection of the blood in the vitreous humor. This is the blood. Okay, this is the blood. Okay, now what are the causes of the vitreous hemorrhage? Vitreous hemorrhage. Why does it occur? Okay, so first cause we'll discuss is the proliferative retinopathies. So there can be diabetic retinopathy, which is the most common cause of vitreous hemorrhage. You should remember this. It is the most important cause of the vitreous hemorrhage. Most important cause. Okay, most important cause of vitreous hemorrhage is diabetic retinopathy. In short, it is known as DR for doctor. Okay, DR for doctor, diabetic retinopathy. So diabetic retinopathy and retinal vein occlusion. In short, it is known as RVO. Retinal vein occlusion. This is also a cause for vitreous hemorrhage. So these two causes come under the heading of proliferative retinopathies, which can cause vitreous hemorrhage. We are going to discuss about the retinopathies and diabetic retinopathy in our coming lectures. Okay, we'll discuss about these retinopathies and about the retina. So the next cause can be due to the trauma. If there's trauma to your eyes, okay, then blood vessels can rupture. Okay, if there's ocular injury, then blood vessels can rupture and the blood can come into the vitreous humor. Okay, so if there's any penetrating of blunt ocular injuries, then the blood can accumulate in the vitreous humor. Then the blood can accumulate in the vitreous humor, leading to the vitreous hemorrhage, right? And if there's ocular surgery, vitrectomy complications. Okay, if you are removing the vitreous humor, okay, that is vitrectomy. Vitrectomy means removing of the vitreous humor. So as a complication of this surgery, normally it does not happen as a result of vitrectomy, but if the surgery goes if the surgery goes eventful or it goes as unplanned, okay, then complications may arise as a result of the surgery. So that can be a cause of vitreous hemorrhage. Okay, so ocular surgeries can result into the vitreous hemorrhage, like vitrectomy surgery, or the penetrating of blunt ocular injuries can also result into the vitreous hemorrhage. Okay, now the third is a retinal tear or detachments. So if there's retinal tear or detachment, means the retina layer, the layer of the retina, the innermost layer of the eyeball retina, if it is detaches from the other two layers, that is choroid and the sclera, if the retinal layer detaches from the other two layers, then what could happen? The blood vessels present in the retina and present in the choroid could easily get burst. Okay, and if it get burst, then what will happen? The vitreous hemorrhage can happen because the blood will leak into the vitreous tube. So that will result in the formation of posterior vitreous detachment. Posterior vitreous detachment with retinal break. Why posterior? Because our eyeball, the retina is present over here. Okay, and this is the, for example, this is the vitreous cavity. This is the lens. Okay, this is the vitreous cavity. So in the vitreous cavity, this is the posterior part. Okay, and retina is getting detached only from the posterior part and not from here or here. Okay, the retina detaches mostly from the posterior part. So if the retina detaches from here, then it will result in the posterior vitreous detachment. Posterior vitreous detachment from, it will involve only this part of the retina and not this or this part. Okay, only this part will be involved. So that is known as posterior vitreous detachment with retinal break, right? So that can also result in the vitreous hemorrhage. Now, fourth is the ocular vascular abnormalities. Now, what are ocular vascular abnormalities? For example, you are having retinal macroaneurysms, okay, retinal macroaneurysms, or you're having choroidal neovascularization. More vessels than required in the choroid layer. Okay, more vessels required. More vessels uh, required. Sorry, presence of more vessels than required. Okay, presence of more vessels than required in the choroidal layer, that could result in the cause that could result in vitreous hemorrhage. Okay. Now, fifth is the inflammatory or infectious diseases. Inflammatory infectious diseases. So, inflammatory infectious diseases. What are the inflammatory infectious diseases that could cause a vitreous hemorrhage? So, two most common diseases that could result in the formation of vitreous hemorrhage are the toxoplasmosis or endophthalmitis. Endophthalmitis is meaning the involvement of all the three layers. Okay, inflammation of all the three layers of the eyeball, that is retina, choroid, and the sclera. Okay, involvement of all the three layers. And toxoplasmosis means the infection of the toxoplasmodium. Okay, so it is an infection of the toxoplasmodium, and endophthalmitis means the infection of the all the three layers of the eyeball. So these are the five main categories for the causes of the vitreous hemorrhage. Proliferative retinopathies. It includes tardive retinopathy and retinal vein occlusion. Trauma. It includes penetrating of blunt ocular injuries or ocular surgeries, retinal tears or retinal detachment, then retinal macroaneurysms or choroidal neovascularization. Okay, then we have toxoplasmosis or endophthalmitis as a result of the infections. Okay, so these are the main causes, and most important of these all is diabetic retinopathy. It is the most important and most common cause for vitreous hemorrhage. Okay, diabetic retinopathy is the most common and most important cause of vitreous hemorrhage. Now, what are the clinical features that you see in a patient of vitreous hemorrhage? So symptoms include sudden onset of floaters. Floaters means something, if you close your eyes or if you just open your eyes also, there will be something floating. Okay, like you can see a layer of liquid floating. Okay, so there can be floaters which is perceived by the patient. There can be blurred vision or sudden vision loss. And they're getting perception of red haze. Red haze, why red haze? Because there has been accumulation of blood. Okay, for example, this is the cornea, this is the eyeball, and this is the lens, and there is accumulation of blood over here. This is vitreous. This is vitreous cavity, full vitreous cavity, right? And there's accumulation of blood over here in this part, right? In this part, there's accumulation of blood. So what will happen? The light enters through the lens and it focuses over here in the retina, right? This is happening, and if the light rays focuses passing through this accumulation of blood area, okay, so what will happen? The image is perceived as the there is something red haziness. Okay, the image is perceived as the image with some haziness of red color. So that is known as perception of red haze, and the signs include reduced visual acuity, reduced red reflex, and difficulty in fundus visualization. Okay, so if you want to examine the fundus, that means you want to examine your whole vitreous cavity along with the retinal layer. And if the accumulation of blood is present extensively, for example, it is covering whole aspect of the vitreous. Okay, the blood is covering the whole aspect of the vitreous, then you cannot examine properly the retinal layer. You cannot examine this layer due to the hindrance of the blood in the vitreous cavity. So that is known as difficulty in fundus visualization. Okay, so you will be having difficulty in fundus visualization because you cannot see the retina and choroid layer properly due to the layer or due to the accumulation of blood over the vitreous cavity. Okay, so that is one main sign of the vitreous hemorrhage. So we have discussed symptoms and signs of vitreous hemorrhage. Symptoms include floaters, blood vision, and sudden visual loss. And there can be perception of red haze. I told you why there's perception of red haze. There can be reduced visual acuity. There can be reduced red reflex. Red reflex means you are not able to recognize the red color as fast as you were earlier. Okay. Earlier you used to identify the red color very fast. For example, suddenly anybody put a red pencil in front of me, then I can suddenly recognize that the pencil is red in color. But now, since I'm having vitreous hemorrhage, I'm so used to the red color that if somebody places a red pencil in front of me, I will recognize it as a red color, but only after a later period of time, because everything appears to me red. Okay, because everything appears to me red, there is a red haziness in my visual field. Okay, so I cannot appreciate the red color of the pencil very nicely. Okay, so that is reduced red reflex. And difficulty in fundus visualization, I told you, because the large area of the vitreous cavity is occupied, and that creates a problem in visualizing the whole fundus area. Okay. Now, what are the complications of the vitreous hemorrhage? So the complications of vitreous hemorrhage includes long-term complications, long-term visual loss, which is secondary to the unresolved hemorrhage or associated conditions. Okay, so if the hemorrhage is present since a long time, it can lead to the visual loss. Obviously, it can lead to a visual loss. And second, it can lead to the proliferative vitreoretinopathy. Okay, proliferative vitreoretinopathy. That means vitreoretinopathy means involvement of vitreous humor and the retinal layer. So formation of fibrous membranes causing fractional retinal detachment. What happens in a due course of time? These blood present in the vitreous humor, it forms fibrous connection with the retinal layer. Okay, it forms fibrous connection with the retinal layer. This is the retinal layer, right? This is the retinal layer, and it forms a fibrous connection with the retinal layer. Okay, now these fibers slowly pulls the retina towards itself. It slowly pulls the retina towards itself, and there's retinal detachment slowly. Okay, the retina is getting detached from the other two layers slowly due to the formation of fibers by the blood in the vitreous humor. Okay, and that fibrous bands pulls the retina towards itself, and it causes retinal detachment. Okay, so that is the main complication of the vitreous hemorrhage. Okay, proliferative vitreoretinopathy, that is known as proliferative vitreoretinopathy. It can also lead to glaucoma, secondary glaucoma to ghost cells, or neovascularization. Okay, so if there is a breaking of the vessels or there's disruption of the vessels, which is leading to the vitreous hemorrhage. So after the vessels has been completely destroyed, all the blood has been accumulated in the vitreous humor, what will happen? New vessels will form in the retina and the choroid layer. Okay, because the old blood vessels has been damaged, so the new vessels will be formed. And since the new blood vessels will be formed, it will again give rise to the more blood supply to the whole eyeball. And if there's increased blood supply, okay, if there's increased blood supply to the eyeball, the IOP will increase, the intraocular pressure will increase. Okay, if the blood vessels are more than required, if the amount of blood is more than required, if the amount of blood supply is more than required in the eyeball, then it can result into the increased IOP or increased intraocular pressure. Okay, and these can lead to the secondary glaucoma. Okay, increased in IOP can lead to secondary glaucoma. So glaucoma can also occur if there is vitreous hemorrhage, or it can happen as a complication of vitreous hemorrhage. Now, what are the infections that lead to the vitreous hemorrhage? Endophthalmitis, I told you earlier, in cases with concurrent trauma or surgery. So if you're having endophthalmitis and you're having any trauma or surgery in the eyeball, then you have the high chances of development of the vitreous hemorrhage. Okay. So we have discussed 4 complications: long-term visual loss, proliferative vitreoretinopathy leading to the retinal detachment. There can be secondary glaucoma due to ghost cells or neovascularization. Okay, and there can be endophthalmitis as well. So these are the 4 these are the 4 complications of the vitreous hemorrhage. Okay, you must remember these 4 complications of vitreous hemorrhage. Now, how do you manage vitreous hemorrhage? Okay, so the initial evaluation includes the history, proper history taking, the visual acuity. You should measure the visual acuity, and you should also measure IOP measurement. IOP is measured by tonometry. I told you, tonometry is used for IOP measurement. Yesterday we discussed about this. There can be B-scan ultrasonography if fundus is not visible. Okay, if fundus is not visible, then you should do B-scan ultrasonography, because fundus, many times fundus is not clearly visible due to the hindrance of the blood layer in the vitreous tumor. Okay, so history taking, visual acuity, IOP measurement, B-scan ultrasonography, these are the initial evaluation of the diagnosis techniques that help us to identify the vitreous hemorrhage. Now, treatment is based on the underlying cause. What is causing vitreous hemorrhage? We have to treat accordingly. So, if it is diabetic retinopathy, so we will be discussing about the management of diabetic retinopathy in detail when we study about diabetic retinopathy separately. Okay, so right now I want to tell you that pan-retinal photocoagulation, in short known as PRP, pan-retinal photocoagulation is the most widely used management technique for diabetic retinopathy. And if the diabetic retinopathy is responsible for causing vitreous hemorrhage, then we treat the diabetic retinopathy, and vitreous hemorrhage will get automatically treated, right? So pan-retinal photocoagulation is the most common and widely used management technique. And also you can give anti-VEGF. VEGF stands for vasculoendothelial growth factors. Vasculoendothelial growth factors. This is a class of drugs. Vasculoendothelial growth factors. Right. So these are the treatment options for diabetic retinopathy resulting in vitreous hemorrhage. If retinal detachment is responsible, then you can opt for surgery. The surgery includes scleral buckle or vitrectomy. Again, we will discuss about retinal detachment separately. Okay, when we discuss about the retinal disorders and the trauma. So the trauma, observe for spontaneous resolution. If there's trauma, then you can observe for the spontaneous resolution, because the blood will automatically get drained out. And if the blood is present for a longer period of time, then you can surgically intervene for complications, because vitreous hemorrhage has a complications, and you cannot wait for, you cannot observe and wait for a larger duration of time. Okay, so you have to surgically intervene if the spontaneous resolution is not happening. And you can also go for vitrectomy, that is surgical intervention only for the vitreous hemorrhage. So if there's persistent hemorrhage for greater than 1 month, then you can go for a vitrectomy. And if there's tractional retinal detachment, if the vitreous hemorrhage resulting in the fibers formation, and the fibers are pulling the retinal layer from the other two layers, okay, resulting in the retinal detachment. So if the retina is getting detached, then you can go for vitrectomy, because it is a very serious and life-threatening disease, the retinal detachment. Okay, there can be permanent visual impairment if you are having retinal detachment. Okay, so you do not want retinal detachment as a complication for vitreous hemorrhage. So therefore, you can go for vitrectomy. And if there is persistent hemorrhage for more than 1 month, then also you can go for vitrectomy. Okay, so we have discussed in the management part. Basically, the management depends upon the underlying cause. Okay, and the most important cause for vitreous hemorrhage is diabetic retinopathy, as we have discussed earlier. So according to the management of diabetic retinopathy, we should go for pan-retinal photocoagulation or anti-VEGF drugs, that is anti-vascular endothelial growth factor drugs, and pan-retinal photocoagulation, that is PRP. Okay. And if the hemorrhage is persistent for more than 1 month, and if there is retinal detachment, then you can go for vitrectomy as a surgical option. Okay, this is surgical option. Okay, so this was about the vitreous hemorrhage. So we have discussed the causes, definition, symptoms, management. Okay, we have discussed about these things in the vitreous hemorrhage part. Now we'll be discussing about the vitreous opacities. Okay, so there are 3 kinds of vitreous opacities: cellular, degenerative, and other types of. So okay, so in the cellular vitreous opacities, we have inflammatory cells. Okay, from uveitis, we have blood cells. That is vitreous hemorrhage. Okay, so if you're seeing any opacities in the vitreous humor or the vitreous cavity, then it could be a result of uveitis. For example, the inflammatory cells are released from the uveal tract into the vitreous humor, or there can be vitreous hemorrhage. Blood cells are releasing from the disrupted or damaged blood vessels. That can be result of vitreous opacity. Okay, and there can be asteroid hylosis and syncytial scintillans. These two are the degenerative vitreous opacities. Okay, we'll discuss about these two later on. Okay, so these are the asteroid hylosis and syncytial scintillans, and other are pigment, retinal attachment, and amyloid deposits. So these can also result in the vitreous opacities. Pigment is released from the retinal layer when it is detaching from the layer. For example, you can see in this diagram, this is the retinal layer. Okay, the retinal layer has been detached from the uh, other two layers. Okay, the retinal layer has been detached, and if the retinal layer has been detached, so what is happening? This is the vitreous opacities. These are the vitreous opacities, right? These are the vitreous opacities. So that is a pigment, and there can be amyloid deposits as well. So you have three kinds. If you are asked about the classification of vitreous opacities, there are three classifications: cellular, degenerative, and other classification. In cellular, you have inflammatory cells from uveitis and blood cells, for example, vitreous hemorrhage. In the degenerative, you have asteroid hylosis and syncytial scintillans, and in the other category, you have pigment from the retinal attachment and amyloid deposits. Now, what is asteroid hylosis? So asteroid hylosis, you can see from the diagram given next to you. So presence of calcium and lipid deposits within the vitreous. Okay, so there are presence of calcium and lipid deposits over here. Okay, you can see this start or giving the appearance like asteroid in a space. For example, consider this cornea as a space. Okay, in the space, you can visualize this deposits of calcium and lipids as asteroids. Okay, so that's why it is known as asteroid hylosis. Okay, so we have presence of calcium and lipid deposits within the vitreous cavity. Now, how does it occur? What are the causes and risk factors for asteroid hylosis? So it is mostly idiopathic in most of the cases, and other than that, it can be associated with diabetes, hypertension, aging. So we can say that it is a very normal phenomena and not very rare phenomena. Okay, it is a very normal phenomena which happens with the diabetic person, with the hypertension person, or it can also happen as a just a result of aging. Okay, so this is not something related to very high or very long-term chronic disease. So what are the clinical features? There can be multiple white, yellow spherical opacities suspended in the vitreous. So there are multiple white, yellow spherical opacities. So the opacities that you can see here, these are present in the vitreous humor. These opacities are present in the vitreous humor, and these opacities are white, yellow spherical opacities, which are suspended in the vitreous. Okay, which are suspended in the vitreous. These are typically unilateral, okay, and asymptomatic. So it is not necessary that these opacities you will found in both the eyes. It is mostly present only in one eye. Okay, it is not present bilaterally. It is only present in one eye and asymptomatic. There are no symptoms. Okay, but mostly there are no symptoms. Now, how do you manage this condition? Since it is a very asymptomatic, since it is mostly asymptomatic condition, so observation is the mainstay of the treatment here. And if it is causing any symptom, for example, visual loss, okay, so you can perform vitrectomy if there is severe visual impairment. Okay, you can do vitrectomy if there is severe and causing visual impairment. Vitrectomy is removal of the vitreous humor, vitreous cavity, right? So what is asteroid hylosis? First of all, you will write the presence of the calcium and lipid deposits in the vitreous cavity. You will draw a diagram of the vitreous cavity and what are the causes and risk factors. It is idiopathic in most of the conditions. Other than that, it can be associated with the other conditions like diabetes, hypertension, or it can also happen as the person ages. Okay, in the clinical features, you can write there are white, yellowish spherical deposits or spherical opacities suspended in the vitreous cavity. Mostly these are unilateral and often it is asymptomatic. Okay. And in the management part, you will write observation is the mainstay of treatment since it is asymptomatic. And if it is causing severe visual impairment, then you can opt for vitrectomy. So this was about the asteroid hylosis. Now, what is syncytial scintillans? Okay, what is syncytial scintillance? So it is a rare degenerative condition characterized by cholesterol crystals in liquefied vitreous. So the vitreous is liquefied, or the vitreous humor is liquefied, and there are the presence of cholesterol crystals. In the asteroid hylosis, you are having calcium and lipid deposits. Okay, you're having calcium and lipid crystals, or you cannot say crystals, calcium and lipid spherical opacities in the vitreous humor. But here you're having cholesterol crystals in the vitreous humor. So the definition we have done. It is a rare degenerative condition characterized by cholesterol crystals in the liquefied vitreous. This is the main point. Cholesterol crystal is the main point, and it's a rare degenerative condition is also the main point. Okay, so it is a rare degenerative condition characterized by cholesterol crystals in the liquefied vitreous. Now, what are the causes and the risk factors? So it is a post-inflammatory or post-traumatic liquefaction of the vitreous. So it mostly happens after any inflammation or infection or after any trauma. It is associated with the chronic uveitis or vitreous hemorrhage. Okay, so you can also write the causes or the risk factor of uveitis or vitreous hemorrhage as the causes of syncytial scintillance. Okay, so whatever things are causing vitreous hemorrhage can cause syncytial scintillance, or whatever things causes chronic uveitis can cause syncytial scintillance. Okay, so you have to frame or expand your answers like this. Okay, so it is a post-inflammatory, post-traumatic liquefaction of the vitreous, and it is associated with a chronic uveitis or vitreous hemorrhage. Now, what are the clinical features? So the clinical features include, it is mobile. These crystals are mobile. That is, it moves from one place to another. It is golden brown in color. It is refractile crystals visible on slit lamp examination. It is bilateral in most cases. So you can see on the right-hand side in the diagram, this is the asteroid hylosis and this is the syncytial scintillance. So in the syncytial scintillance, you can see the opacities are visible as golden brown in color. It is mobile. That means it will move from one place to another. And these are refractile crystals. That means it will shine. Okay, and it is also visible in the slit lamp examination, and it is most often bilateral. Okay, it is most often bilateral, unlike asteroid hylosis, which was unilateral in most of the condition. Now, how do you manage this condition? Observation rarely requires intervention. So, just like the asteroid hylosis, here also you have to observe for the symptoms, and if the symptoms are very disturbing or very severe, then you can go for vitrectomy. Okay, so the management is same, observation and vitrectomy if severe. Okay, so this was about syncytial scintillance. Now we will discuss the differences between these two. So this is just a review of the two diseases. So deposits in the asteroid hylosis and the syncytial scintillance. So the calcium and lipids are deposited in the asteroid hylosis and cholesterol crystals are deposited in the syncytial scintillance, right? Location, these are adherent to the vitreous framework and these are freely mobile in liquefied vitreous. Since the vitreous humor is liquefied in syncytial scintillance, the vitreous humor is liquefied, that's why it is freely mobile. Okay, in asteroid hylosis, the vitreous humor is not liquefied. Instead, it has a consistency of a gel. Normally, the vitreous humor has a consistency of a gel, not that of a liquid, right? It is a semi-solid. But in syncytial scintillance, there is a liquefaction of the vitreous. It requires the consistency of a liquid. So therefore, the cholesterol crystals are mobile in syncytial scintillance. Whereas in asteroid hylosis, the calcium and lipid deposits are not mobile. It is adherent to the vitreous framework, right? It is usually unilateral. It is usually bilateral. Okay, unilateral, bilateral. Clinical significance, often asymptomatic, rarely symptomatic. It means one and the same. Okay, both are asymptomatic often. Okay, these are both are often asymptomatic, and observation is the mainstay of treatment for both of the diseases. You don't need to give extensive antibiotics or extensive medications for these two diseases. And if these two diseases causes a significant visual impairment, then only you need to perform vitrectomy. Otherwise, only observation is recommended. So how do you manage vitreous opacities? So history examination, you have to examine through the fundus examination. Examination means fundus examination, right? Examination means fundus examination. So if there's any floaters or vision loss, Then you need to manage vitreous opacities. Examination includes slit lamp and indirect ophthalmoscopy. That means fundus examination. Okay, slit lamp and indirect ophthalmoscopy. Diagnostic tests. What diagnostic tests you can run in a patient of vitreous opacities? You can do B scan ultrasound. B scan ultrasound. B stands for brightness. Okay, B stands for brightness. So B scan ultrasound for dense opacities. Okay, so the B scan ultrasound will so these ultrasound images will appear very bright. Sorry, if in these ultrasound images, if there are opacities present, the opacities will appear as a flashing light. Okay, so that's why it is known as B scan ultrasound brightness scan ultrasound. Okay, for dense opacities, and management is observation only for benign conditions, and vitrectomy if the vision is compromised. Okay, observation and vitrectomy. These are the two main treatment options for the vitreous opacities. And history examination, first you have to do to determine what you are going to or what management you're going to give to your patient, right? And which is one of the most common diagnostic tests. B scan ultrasound is the most common diagnostic test for dense opacities, not for the lighter opacities. Okay. Now, what are the complications of vitreous opacities? So they can be persistent visual disturbances. Okay, persistent visual disturbances. There can be visual impairment. Slowly, everything will look blurry. Okay, secondary retinal detachment. There can be retinal detachment as a result of the vitreous opacities. There can be increased risk of increased risk of proliferative vitreoretinopathy. I told you, the proliferative vitreoretinopathy will cause retinal detachment. Okay, there can be secondary glaucoma due to inflammatory or hemorrhagic debris. Okay, the hemorrhagic debris will cause increase in IOP, and that will cause secondary glaucoma. So there can be visual impairment, retinal detachment, proliferative vitreoretinopathy, or in short, you can say PVR, proliferative vitreoretinopathy. There can be secondary glaucoma due to increased IOP. Right? These are the 4 complications of vitreous opacities that you should keep in your mind. So this was a very small topic, that is vitreous part, and we have discussed about vitreous hemorrhage, we have discussed about vitreous opacities, we have discussed about the osteohyalosis, we have discussed about the syncytial scintillance, we have discussed about the management of vitreous opacities and all the things that is important with respect to vitreous part. Okay, vitreous hemorrhage is the most important question in the vitreous part, so you should not miss this topic, since it is a very short topic and very high scoring topic. Okay, so you can get maximum marks on no such difficult concepts are there. All the concepts are very easy to understand. So I hope you learned from these topics, and you took the key points. Okay, you took the key points that you have to write your answers, and you should also always draw the diagram. Okay, the one diagram that is most common. Okay, the one diagram that is most common is this one. Okay, so you should draw at least this diagram in your exams. Okay, this is a diagram that you should draw, and you should also label over here like this. Okay, you should just draw a patch of red color showing the vitreous hemorrhage or the vitreous opacities. If it is vitreous opacities, draw it with yellow or white color, or if it is vitreous hemorrhage, just put a red color area, or mark the shade the area with the red color, and just label it as vitreous hemorrhage. Okay, so this will give the idea to the examiner that you know what is vitreous humor, you know what is vitreous hemorrhage, you know from where the blood is coming in the vitreous hemorrhage part, what is the complications of these vitreous hemorrhage, what are the risk factors of causing vitreous hemorrhage, what are the causes of vitreous hemorrhage, what are the management options for vitreous hemorrhage. So you should know all these topics, and that's all for today. We'll meet again in our next live class. Thank you. Hello.
Yes, sir.
Okay, I finished. This was a very small lecture.
Okay, sir. Thank you.
Okay, thank you.